Friends, good afternoon. I was just going through the video that I posted previously on pneumonia. Then I realized there are few important points that have not been addressed, and some of these were raised by my patients. So, I thought I will just clarify it now. Number one, it is not like all the pneumonias are crippling and then kind of it puts you in the hospital immediately. It is not like that. Some are very insidious, meaning very slow, gradual onset. We call it walking pneumonia, because these people, they have infection like pneumonia, but they are just walking around. They probably come to work, they go to school, and then after a few days they realize they are getting more fatigued and a little bit breathless, the cough is getting worse, and then the fever is not subsiding like that. At that time when they come for consult, we think this could be a walking pneumonia. When you do an X-ray, we see infiltrates in the chest X-ray. Do a blood count, then probably it shows a raised blood count, or in some infections a normal count. There is one bacteria that I failed to mention. That is a very important bacteria, because we are talking about it now. In China, they are talking about a Mycoplasma pneumonia. It is a bacteria which is being resistant to the traditional antibiotics. Mycoplasma pneumonia is one of the most common bacteria that causes what we call a community acquired pneumonia. When we talk about pneumonias, I mentioned about viral pneumonia, bacterial pneumonia, and there is a fungal pneumonia, and there is a pneumonia that affects immunocompromised people, pneumocystis carinii pneumonia, PCP pneumonia we call it. Now, I am telling about community acquired pneumonia versus hospital acquired pneumonia. Community acquired pneumonia is an infection of the lungs which is caused by bacteria which are commonly present in the community. They are usually more friendly. The community may not be very friendly, but this bacteria is friendly. That is why it is called a community acquired pneumonia, and it does respond to the regular antibiotics. I mentioned about macrolides antibiotic called azithromycin, clarithromycin, and doxycycline, and amoxiclav, those things, and cephalosporin combinations. They are all very effective for this kind of levofloxacillin. They are all very effective, but they are now mentioning about a resistant mycoplasma which does not respond to these traditional antibiotics. Any times when they talk about resistance to antibiotics, we get really worried, because we see lot of tuberculosis which are resistant to the regular TB medicines, especially in HIV patients. The bacteria, they get smart, when they are getting exposed to some antibiotics repeatedly, they start producing an enzyme which makes the antibiotic ineffective. So, we need to go with a higher antibiotic to address the infection. This is what we mean by resistance. So, this community acquired pneumonia caused by mycoplasma is something that you all have to know. Now, China is reporting a lot of resistance. Do not worry at this point. I do not think we are seeing patients at this point where we are not able to take care of the pneumonia with the traditional antibiotics that we give. But there are some patients with pneumonia who really need to be hospitalized, because their oxygen is falling, the general condition is poor, the hydration is poor, they have a very high fever, or they just look sick and they need oxygen supplement, they probably need some nebulizers to help them breathe better. So, those patients end up in the hospital. While they are in the hospital, most of the time we end up giving IV antibiotics, not the oral ones, but the IV antibiotics. And if they are admitted because of a hospital acquired pneumonia, usually the bacteria are different. They are more virulent bacteria, they are not as friendly, they need higher antibiotics, stronger antibiotics, like injectable antibiotics, like combinations of piperacillin, tazobactam, like that. So, we got a very small portion of pneumonia patients who are not very sick, just like walking pneumonia. We have a large group of pneumonia patients who may just be treated as an outpatient with oral antibiotics. We also have a small sector of very sick asthma, pneumonia patients who are needing IV antibiotics. These are the important things I want to tell you. And it is not like all the pneumonias can get picked up in the X-ray, some we miss and sometimes want to study better. So, we ask for a CT of the chest, high resolution CT chest, which will pick up even small infiltrates, and also it may throw some light on the origin, the etiology or the cause of pneumonia, because viral pneumonia looks differently, bacterial pneumonia looks differently. In the CT we can define better. And TB can also cause pneumonia, it is called a tuberculous pneumonia, they present differently. There is one more pneumonia you all need to know, it is called aspiration pneumonia. Patients sometimes aspirate gastrointestinal, like contents from the stomach into the lungs. Maybe they were unconscious after a road traffic accident, or they are drunk and they become little drowsy and they aspirate, or they have a very severe acid reflux and they aspirate. So, there are so many causes of aspiration. So, if they aspirate fluids into the lungs, it causes an aspiration pneumonia, then the treatment will be different, because many bacteria are involved in the aspiration. So, in a nutshell, we talked about all aspects of pneumonia today, and the most important take home message is the most common important pneumonia caused by pneumococcal pneumonia can be prevented by 2 doses of pneumonia vaccine, and besides that everybody needs a flu vaccine, because patients who are infected with a flu virus can develop a secondary bacterial pneumonia, and influenza virus itself can cause pneumonia, and some of them may not even respond to treatment, they may actually die. Because of this, prevention is very important. All of you who listen to that should take home this message. Vaccines are a must. Pneumonia vaccine and flu vaccines are very essential, and flu vaccines are annual vaccine, a single vaccine, and pneumonia vaccine is only 2 doses, 1 dose now, the second dose 6 months to 12 months apart. Thank you.